Hello students, after discussing pharmacology of NSAIDs and aspirin, in today's video we are going to study pharmacology of paracetamol. Paracetamol is also called as Acetaminophen. Paracetamol is a very well-known drug. It is extensively used as a mild analgesic, that is a mild painkiller, and antipyretic as it reduces fever. Unlike aspirin, paracetamol has negligible anti-inflammatory action. Now let's talk about the mechanism of action of paracetamol. By now we know that NSAIDs like aspirin inhibit the enzyme cyclooxygenase and reduce synthesis of prostaglandins that cause inflammation, pain and fever. Paracetamol also inhibits the enzyme cyclooxygenase and reduce synthesis of prostaglandins. But unlike NSAIDs, paracetamol has no peripheral action. It does not block cyclooxygenase enzyme expressed at the peripheral sites of tissue injury and inflammation, and thus it has no anti-inflammatory action. It inhibits COX centrally, that is in the brain. Paracetamol or acetaminophen is a mild analgesic. It reduces mild pain, for example during mild headache, dysmenorrhea, but it is relatively ineffective when the pain is due to prominent inflammation. For example, it is ineffective in reducing pain of rheumatoid arthritis. It inhibits the enzyme cyclooxygenase, that is COX centrally, and thereby reduce prostaglandin synthesis in the brain. It also increases pain threshold and thus person tolerates more pain. Perception of pain is less. It reduces perception of pain. Paracetamol has antipyretic activity. It reduces fever. Paracetamol is one of the best drugs to be used as antipyretic, especially in children. Unlike aspirin, paracetamol does not produce Reye syndrome in children. Paracetamol inhibits cyclooxygenase enzyme and reduces synthesis of prostaglandins in hypothalamus, that is in the brain. Now let's understand the pharmacokinetics of paracetamol. Paracetamol or acetaminophen is well absorbed orally. Plasma half-life or T-half is 2 to 3 hours. Its duration of action is 3 to 5 hours. It is metabolized by conjugation. It conjugates with glucuronic acid and the metabolite formed is excreted rapidly in the urine. Now let's understand the dose of paracetamol. Paracetamol is available in two strengths, 325 mg and 650 mg. Usual dose for an adult is 650 mg 4 to 6 times daily, but maximum daily dose should not exceed 2600 mg per day. Otherwise, it can cause liver and kidney toxicity. Now, let's discuss the therapeutic uses of paracetamol. Paracetamol is a mild analgesic. It can be used for mild headaches, mild migraine, musculoskeletal pain, for example, pain of joints, ligaments, tendons, etc. It is also useful in dysmenorrhea, that is in relieving menstrual pain. As an antipyretic, it is one of the best antipyretic. Its use is safe in children also. Unlike aspirin, paracetamol does not produce hyperventilation. That is, paracetamol does not produce respiratory stimulation and hyperventilation that causes respiratory alkalosis. Paracetamol does not produce metabolic acidosis. Paracetamol causes insignificant gastric irritation and thus there is no risk of peptic ulcer. It has no antiplatelet effect and thus it does not cause increased risk of bleeding. And apart from this, it does not produce Reye syndrome in children. That is, it does not produce liver and brain inflammation. And therefore, its use is safe in children with viral infection. Allergic or hypersensitivity reactions are rare with paracetamol. Paracetamol can be used in pregnant as well as in the lactating woman. Now let's discuss the adverse effects. In recommended doses, paracetamol is safe as well as well tolerated. Mild side effects like nausea and rashes occur sometime, that is, nausea and rash occur occasionally. Leukopenia is rare. However, in high doses, paracetamol or acetaminophen can cause liver and kidney damage. Acetaminophen is very well tolerated, but paracetamol toxicity or acute paracetamol poisoning can occur in children. It can occur in small children, as liver function in children is not very well developed. So if paracetamol is not completely metabolized and excreted, it can cause toxicity in small children. In addition to this, overdose of paracetamol can cause toxicity in adults also. Paracetamol toxicity can cause liver damage and renal failure. Patient can become unconscious and patient can reach coma. Now let's understand the mechanism by which paracetamol or acetaminophen produce toxicity. So let's first understand how acetaminophen is metabolized in the body. Acetaminophen is conjugated with the glucuronic acid in the liver to produce non-toxic metabolite, that is acetaminophen glucuronide. Acetaminophen glucuronide is excreted rapidly in the urine. But when a very large dose of paracetamol is taken, this pathway gets saturated. That means this pathway gets overloaded and becomes ineffective to metabolize all the paracetamol, and thus excess paracetamol is shunted to or diverted to another pathway. So excess acetaminophen is oxidized by the liver cytochrome 3A4 enzyme. Acetaminophen is oxidized to a highly toxic and reactive metabolite, that is N-acetyl parabenzoquinone, in short NAPQI. Now NAPQI is conjugated with the glutathione to produce NAPQI glutathione, that is excreted from the body. But high doses of acetaminophen deplete glutathione stores. So NAPQI is neither conjugated to glutathione nor it is excreted from the body. And since NAPQI is highly toxic and highly reactive, it forms covalent bonds with the proteins of liver cells and renal tubules. This causes necrosis of liver cells and renal tubules, which in turn causes hepatotoxicity and nephrotoxicity. So paracetamol should not be given to small children. It should be given to small children only in consultation with physician. In adults, daily dose of acetaminophen should not exceed 2600 milligram. Now let's understand how paracetamol toxicity is treated. Now patient should be treated as early as possible. Treatment becomes ineffective if started 16 hours or more after using paracetamol. First, vomiting is induced or gastric lavage is done. Gastric lavage is a process to clean out the contents of stomach. Vomiting or gastric lavage removes paracetamol from the stomach. Then activated charcoal can be given to the person. Activated charcoal absorbs paracetamol. So even if paracetamol is in the stomach, it is not absorbed in the blood. Then N-acetylcysteine. N-acetylcysteine is a specific antidote of paracetamol. It is a glutathione precursor. N-acetylcysteine regenerates glutathione so that NAPQI is excreted from the body. So this is how paracetamol toxicity is treated. So this is in brief about paracetamol. If you find the video useful, kindly like, subscribe and share this video. Please do not use this information for the clinical purpose. This information is meant specifically for the students from their examination point of view.